My name is Elizabeth Murphy. I am an occupational therapist by profession. I've been practicing mostly in the hospital setting. And what an occupational therapist does is we help people to be able to be more independent with their what we consider activities of daily living. And that includes all sorts of body parts, including functional use of the arms. What I know as an occupational therapist, as well as what I know as someone who has been injured, how important the use of both of your arms are, especially your dominant arm, in being able to be a functional individual. And what does that mean? Simple things like being able to eat a meal, cut your food. For me, to be able to do my makeup, it's huge for me, and put my hair up in a ponytail. Very basic things. And so that's a lot of what I do. And when someone has a limitation due to, say, an elbow fracture, which was my case, and kind of the whole arm was traumatized from a bike crash, you see firsthand as a person how limited you can be. And when you're an athlete on top of that, you want to get back to doing not only your basic life tasks, like being able to eat your food and put on your makeup and get dressed on your own, but you also want to get back to sport. Now, I will also throw in there, hugely important for me as part of my identity, and this is something that occupational therapists focus on, is we balance out the physical with the mental health aspects of illness and injury. How vitally important it is to get back to work for a lot of us, and work, for my profession, to not be able to work because of an injury. I wanted to get back as quickly and efficiently as possible. I'm an incredibly active person. I do all sorts of sports, anything on two wheels, any type of a bike. I'm a competitive cyclist. I compete in cyclocross, track cycling. I also compete in the sport of luge. And this is I do a lot of training during the week. And then on the weekend, it's races and whatnot. So my story is I was competing in a cyclocross race, which is it's on a bike and it's off-road. And I had gone and previewed the course a couple of times and saw where there were some sections that were, I had to really pay attention. And everything was going really well until very suddenly it was not going well. I found myself very abruptly crashing down onto my right side. And I let out a yelp, and it's normal to crash in any sport. And I realized right away something's wrong. And it wasn't just a normal, ow, boom, get back up, get on the bike. When I crashed, I basically came down onto my right side, and I drove my humerus here right down through my olecranon. I also injured the shoulder and the wrist in the crash. Unfortunately, what happened is the force of my upper arm bone humerus going down into this lower part of my elbow, my olecranon, it caused a fracture in many different pieces. Immediately, they did an x-ray, and I said, yeah, I'm pretty sure I just hammered that olecranon into pieces. And sure enough, I was very fortunate in the fact that I was able to get into surgery the next morning. So there wasn't a delay, and that's hugely important. But because of the trauma, there was a lot of swelling and just other damage. And that impacted me kind of right away, even with my surgery and getting, out of immobilization, which is another key part to trying to, elbows are very notorious. Therapists who treat people with elbow fractures will tell you that they are very notorious for getting stiff very quickly. Luckily, my surgeon was great, specializes in trauma. I was out of my cast within a week, and they were encouraging me to do active elbow flexion right away, bending that elbow as much as I could. Despite all of that, I quickly became very stiff. In talking with the therapist that works with me on an outpatient basis, I asked her, the other day, I said, so stiff, how stiff was I? She said, oh, you were very stiff. And I mean, my motion was so limited. I couldn't functionally use my arm. After several weeks, when it became apparent that, when she's trying to help me arrange and when I've been trying to help move my arm, it did not want to go very far. And she said to me, hey, so I'm thinking about getting you this brace, this thing called a jazz brace. And I was like, a jazz brace? I've been a therapist mostly in the hospitals, and I was like, what's a jazz brace? And so she told me about it, and I said, okay, I'm going to research it. Because as therapists, we always want to understand, if we're going to recommend something to a patient, and I wanted to understand as the patient, what is this thing? And I went on the website and I was like, oh, and I started reading some evidence-based articles and whatnot. And I said, okay, I get this. And I understood very quickly how beneficial this could be to me for achieving my goals, which was regaining that mobility, that flexion. Functional range of motion in an elbow is from 30 degrees of out straight to 130 of flexion. I was nowhere close, and I couldn't see an end in sight. So when my therapist recommended this brace to me, and I had done my research, I couldn't get it fast enough. And when I got my brace, and I was fit with it, and the therapist trialed it with me in the clinic, and I was like, yeah, okay. So I'm going to wear this 3 times a day, 30 minutes at a time, and we're going to keep increasing it as far as how much flexion or how much bend we're going to create. And we're going to do it on a scale of 0 to 10, 0 being no stretch, 10 being stretch that you really can't tolerate. The methodology is to go to a stretch of 2 to 3. So I will say, for someone who's kind of competitive, my therapist had to keep reinforcing to me, less is more. And I might have cranked it a little bit too much a couple of times, but then I realized, okay, yes, the therapist knows better, and all the research that has been done over the plus 30 years that the brace has been around, that 2 to 3 of stretch. And I was like, that doesn't feel like much. But it's that submaximal stretch so that you're not eliciting that pain response and that guarding, which is what's done with other types of devices, I think, that, and maybe even by the patient if they're manually trying to stretch it, it's hard to maintain that and let all of those muscles, everything relax and just accept it. And so here I have this brace and I'm using it, and I'm like, it's just not, something feels uncomfortable. And it was actually at my wrist. You go back to the fact that when I crashed my bike, I injured not only the elbow, but I actually injured the wrist, and we didn't know that until we knew it. And I'd injured the shoulder. So I got on the phone to Jazz. I called them up and I said, hey, so here's my my issue. I'm having this pain here, and just having the cuff here. I said, I feel like I need something more supportive. They talked with me not only as, a patient. Now here I am throwing in my therapist jargon, and they were all over it. They said, well, what do you think about this? What do you think about that? Within only a few days, I get this package on my front door. They had fabricated a whole new distal cuff for me. And this whole section here, they even padded it extensively. They sent me additional padding. So why is this important to me as not only a patient, but as a therapist? Well, as a patient, it made it so much more comfortable. So I could tolerate it, so I could be compliant with the use of my device. As a therapist, someone who might, see patients with elbow fractures in the future and recommend this device, I was blown away by the level of customer service. To me, if I'm recommending anything to a patient, I want to be very comfortable knowing that I am going to get excellent customer service from whatever company I've recommended. I've interacted with many companies over my course of experience as an occupational therapist, and I can honestly say that the level of customer service that I received as a client through Jazz, it's the top. It's absolutely, and I feel very confident that if I had issues with what they had even sent me as like an add-on cup, that I could have called them back and they would have made it right. So hugely important to me as a patient and as a therapist. From a therapy perspective, it helps, I would believe, incredibly with compliance. Therapists were giving our patients home exercise programs to do, and we are crossing our fingers that they are going to be able to do them. And we need to give them the tools to help them get better. What things impact a patient's compliance? Ease of use, how much pain is it going to cause? Things of that nature. And things like the Jazz brace, they make it so that you can use that brace. It doesn't have to, life doesn't have to impact it, meaning that like over the holidays, over the Christmas holiday, I was 10 weeks out or so from my surgery and I had my brace. Well, we were traveling for the holidays. Well, I didn't let that hamper me. I had the brace on in the car. I can use it anywhere. We traveled, my husband and I traveled so that he could compete in a luge event. I had my device with me right there at the luge track. I could use it when I was in, maybe one of the facilities there in the lodge. I could put it on and I could be compliant. So I didn't have to have a setback in my overall recovery. It was so easy. It's very portable. And for therapists to know, especially from a therapist who has used one, I think that's really important, that you'll get really good patient compliance in the majority of cases. I personally, I see the huge benefit that use of my brace has made. And I love it when I go in to see my therapist and she's like, wow, look at that improvement in your range of motion. And I'm like, yeah, it's not only from what my Jazz does, but it's also definitely from the interventions that she provides. And we want to give that therapist the time to do the more specialized interventions like joint mobs to an elbow or use of other strategies to help with that tissue extensibility and ultimately then strengthening and coordination. My brace was initiated as soon as it could be initiated. There's a time at which, I myself, being the competitive person and wanting to get better faster, I wanted things sooner. But my therapist and my provider knew, no, we're going to get it to you at the right time when the tissue and the healing is at a point where it can accept this. Overall, I'm so incredibly grateful, not only to the huge team of doctors and therapists, my family, my friends who supported me, but really to Jazz for being a tool that I didn't even know existed, and now I know it, and I'm like, boy, I may not directly be involved with patients in the outpatient setting, but I can start having those thoughts in my head when I see those patients with my type of injury in the hospital, see their presentation and say, I want to put that in my report so that when they go to outpatient therapy, they have that information that, you may want to think about looking at something like a static progressive splint if they don't get a fast recovery in their range of motion, if it's more than just normal joint stiffness.